How to fix folliculitis scalp, safe and effective treatment. Folliculitis is common in those who work with or have children who play sports. It can also affect people who accidentally drop objects or make sharp movements. If left untreated, it can result in scalp sores that can grow stubborn and difficult to treat. In this blog post, you will learn how to remove folliculitis from your skin, treat folliculitis without the use of antibiotics, reverse the effects of folliculitis on the next regrowth of hair. From time to time, we all fall victim to folliculitis. It's one of the most common skin conditions we encounter in our daily lives, and its causes are completely unknown. There is no cure for this condition, only a good and safe treatment. Let's explore what that might be. How to fix folliculitis scalp, safe and effective treatment. What is folliculitis? Folliculitis is an inflammation of the scalp that causes sores and redness. It is also known as hair loss or hair withdrawal. The sores and redness are normal and due to the growth of new skin. The condition becomes worse if you stand or sit for longer periods of time, if you walk or run a lot, or if you exercise a lot. What does scalp folliculitis look like? Scalp folliculitis usually presents as small, red, and very itchy bumps on the scalp. These bumps may be filled with pus or have a whitish yellow-colored cap covering them. In some cases, the bumps may be larger and more numerous. They may become painful and may even lose fluid. The inflamed area may also be scaly and red, with small, red spots on the scalp near the hair follicles. In severe cases, the scalp may become swollen and tender. It is important to seek medical attention if you suspect you have scalp folliculitis, as it can lead to more serious conditions if left untreated. Why is folliculitis so common? Think of it this way: your average 12-year-old is likely to be prone to the condition, but yours isn't. It's a common condition and can often be treated with antifogging creams, foaming hot water and a good moisturizer. But people may also develop the condition after being in an accident where they accidentally drop something or make a sharp movement, such as what you did when you fell and hit your head on the ground. Or they might be an active user of drugs, alcohol or other substances that cause inflammation. What causes folliculitis in the first place? There are a few potential causes of folliculitis, but the most common is exposure to drugs and chemicals, especially those that cause anxiety, depression or any other condition that can cause inflammation. These might include stress, anxiety, an injury, surgery or illness. Best way to treat folliculitis with no medications needed. As we already mentioned, it's important to remove the cause of folliculitis. If it's not possible to do it yourself, a doctor can do it for you. After that, you need to make sure that you get your period every month, get your turn libido and get in the mood to have fun by having an extra large smile. What is the treatment for scalp folliculitis? Scalp folliculitis is a common skin condition that affects the hair follicles on the scalp. Treatment for scalp folliculitis depends on the severity of the condition. Mild cases of scalp folliculitis can be treated with over-the-counter topical creams or ointments, such as those containing benzoyl peroxide or salicylic acid. For more severe cases, a doctor may prescribe topical antibiotics, oral antibiotics, or antifungal medications. In cases of severe scalp folliculitis, a doctor may need to scrape the affected area to remove any pus or debris. In some cases, a doctor may also recommend a steroid injection to reduce inflammation. For severe cases that do not respond to treatment, a doctor may recommend a laser treatment or surgery to remove the affected hair follicles. Final words. Folliculitis is a common condition, and it's common for people to get it after being in an accident where they accidentally drop something or make a sharp movement. It can also occur after being in a fight, a nice running event or even after a heavy activity, such as lifting a heavy object or using a high-intensity workout. It can also happen during premenstrual and wartime, when people are exhausted from work, and it's not a good time to be an outdoors person. If you think you might have folliculitis, seek medical advice or contact your healthcare practitioner. You can also check out this article of the symptoms and how to recognize it for better or worse. If you think you have folliculitis, immediately call your doctor right away and run a physical, including a full body hair check and a skin allergy test. This will be a big help in deciding what to do next.